Hello everyone, welcome to our thesis topic, exploring strategies to enhance nurses' effectiveness in managing patients with stroke in acute and early post-acute care settings. My name is Martin Odhiambo and my colleague is Daniel Agbeko. Stroke remains one of the leading causes of disability and death worldwide. It occurs when there's a blood flow blockage to the brain is disrupted. Which is also called hemorrhagic stroke, which results in brain damage. There's a financial burden and a social burden to the families and healthcare systems. The methodology that we use is literature review. The inclusion criteria is studies that are in English. The exclusion criteria, studies that had nothing to do with nursing. And then there was screening of titles and abstract, content analysis, and finally we settled on 20 peer-reviewed articles. The purpose of our thesis is to synthesize evidence practices in nursing that enhance nurses' clinical competence in managing stroke patients in acute and early post-acute care settings. Our findings were as follows. Number one, early assessment and rapid intervention, especially by nurses. This was very critical because a stroke is an ailment that deteriorates with time, becomes worse. So the earlier the situation is arrested, the better. Now, second finding is structural bundles and care bundles, such as the first care bundles, which is fiber, sugar, and swallowing, or the ACE STAR model, which provide consistent guidelines, especially in high volume resource limited stroke units. The third finding was competency development and education among nurses. Nurses need continuous education, continuous improvement in their skills, in their professional skills. Interprofessional collaboration was the fourth finding, that all the disciplines in healthcare settings, the physician, the physiotherapist, the radiologists all need to work hand in hand to ensure better results. The fifth finding is complication management and secondary prevention. This also, nurse plays a very big role in this, monitoring and preventing complications, including delirium, hemorrhage, anxiety, and depression. Patient-centered care is the sixth finding. Every patient is unique in their own way, and the nurse needs to come up with a care plan that accommodates the specific needs of every patient. The seventh finding is clinical monitoring and acute patient surveillance. Again here, nurses play a critical, one of the main duties and responsibility of nurses is to monitor patients, and especially stroke patients need constant and consistent continuous monitoring. The eighth finding is quality improvement, implementation science and stroke. Yes, as the name suggests, several studies emphasize the impact of quality improvement initiatives and structured implementation strategies. Evidence highlights adopting process management, protocol-driven care, and organizational changes that improve door-to-needle time. So, in conclusion, strengthening nurses' effectiveness together through protocol-based intervention, interprofessional collaboration. All this includes the stroke victims and early acute symptoms. Thank you all for your time.